Welcome to the Explainer, where we take these super dense reports and turn them into guides you can actually use. Today, we are diving headfirst into the EU Commission's latest evaluation of its huge medical device regulations. And let me tell you, this is way more than just red tape. This is about the future of innovation and patient safety right across Europe.
All right, so here's how we're going to tackle this. Think of it as your strategic guide. First up, we'll get into the pain points and what's really at stake here. Then we'll jump into an efficiency playbook, how to actually get things done. After that, we'll look at the innovation gauntlet, especially for startups. We'll solve the predictability puzzle and wrap it all up with a future-proofing checklist.
Okay, first things first. Let's talk pain points and high stakes. We really need to understand why this evaluation is such a big deal.
Sometimes a single sentence just says it all. And this quote from the report, this is it. This is the heart of the matter. Everyone, and I mean everyone, is saying the same thing. The system is just too complicated. It needs to be simpler. Everything else we're going to talk about really stems from this one core problem.
So let's back up a bit. The whole point of these regulations, the MDR and IVDR, was solid, right? You had these huge scandals. Think faulty breast implants, bad hip replacements. The EU had to step in, boost patient safety, and get everyone on the same page. That was the promise. But the reality on the ground? Whoa, it's a whole different story. We're talking about a mountain of paperwork, a real risk that will run out of certain devices, and, believe it or not, a huge drop in trust from the very people inside the system.
In this chart, wow, it just lays it all out there, doesn't it? When you ask the stakeholders, the people living and breathing this every day, if the MDR has actually built more trust, a whopping 55% say no. Flat out no. Only 20% agree. This isn't just some small disagreement. It's a massive trust deficit, and that has real-world consequences for everything from getting funding for new ideas to making sure patients get the tech they need.
All right, Section 2, the efficiency playbook. Let's get into some practical advice on how to cut through all that red tape. Okay, now look at this number, 82.8%. That is huge. It's not like a 50-50 split. We're talking more than 4 out of every 5 people involved saying the paperwork is just too much. That tells you this isn't a problem for just a few companies. It's a massive, system-wide issue. And here's where that pain really hits home. This timeline shows the journey to get a new device certified. We're looking at best case, maybe 13 months. Worst case, 2 years or even more. But here's the interesting part the evaluation found. The time is split pretty much 50-50 between the manufacturer getting their stuff together and the notified body doing the review. So yeah, both sides need to be more efficient, but it all kicks off with a perfect application from your side.
So, what can you actually do about it? Well, the key is to nail the things you have control over. Tip number 1. Get your application perfect. Can you believe over half of all rejections are just because the company applied to the wrong notified body? That's a totally avoidable headache. Next, dodge the simple mistakes. Incomplete forms, wrong classifications. That's another quarter of rejections right there. And looking ahead, really dig into the details, like how you justify your post-market clinical follow-up, or PMCF. And for sure, get your digital house in order for UTMed coming in 2026. It's not optional anymore. Okay, let's switch gears. What if you're a small startup with a brilliant idea? How do you survive this? Let's walk through a little case study.
So, let's invent a company. We'll call them Innovate Diagnostics. Picture this. They've created an amazing AI-powered device for a rare kid's disease. It's a total game changer. But they're small, and this thing is high risk. The regulatory mountain in front of them looks impossible to climb.
So, Innovate Diagnostics can't just play by the old rules. They have to be smarter. Their playbook is all about strategy. First, by going after an orphan device for a rare disease, they open up special pathways. Then, they need to get in touch with the EU's expert panels super early for advice. That's a huge new resource. They should absolutely apply for the new breakthrough device status, and they should be looking at cool new things like regulatory sandboxes to test their tech, all while keeping an eye out for fee reductions available to small companies like them. It's about using the system, not just fighting it.
All right, let's zoom out a bit. We've talked about what one company can do, but what about the whole system? It can be so unpredictable. Let's tackle that predictability puzzle.
And this is where it gets really serious. The numbers here are pretty scary. We're seeing almost 400 official complaints about devices just not being available. And look at this. Nearly half of all doctors surveyed said, yep, I've had trouble getting the device I need. This is especially bad in really specialized areas like cardiology for kids.
This is the real-world impact of all that regulatory friction. It's hitting patients.
So the message here is crystal clear. You have to build a resilient operation. What does that mean? It means you're constantly watching the EU's list of critical devices, so you're not caught off guard by shortages. It means you're using your post-market surveillance data as your own personal early warning system. And this is a big one. You need to understand the new rules of the game for settling disputes, like this thing called the Helsinki procedure. That's the formal process for when countries can't agree on a device's status. Knowing how that works before you're in the middle of it is absolutely key.
Okay, last section. Let's look to the future. The regulatory world never stands still. So how do you stay ahead? Here's your future-proofing checklist.
This image says it all, really. MedTech isn't its own little island anymore. It's this complex web. Your device strategy now has to connect with the AI Act, data privacy laws, cybersecurity rules, and a ton of environmental regulations. You just can't think about the MDR in a vacuum anymore. You have to see the entire landscape. So what this really boils down to is that your strategy has to be holistic. Got AI in your device? You've got homework to do on the AI Act. You need to get your head around all the green rules for batteries and packaging. You absolutely have to go all in on digital, from electronic instructions to the UDEMED database. And finally, don't forget the global view. The EU's CE mark is still a massive deal worldwide, and the EU is getting more influential, not less. So we'll leave you with this question, because it's really the question at the heart of this whole thing. The EU regulations are aiming for the absolute highest standard of safety, which is great, but what's the cost? What's the cost to innovation and to making sure devices are actually available? And maybe the biggest question of all is, in the long run, can the system actually afford that cost? It's all a balancing act, and right now it feels like the scales are tipped. The challenge for everyone is figuring out how to balance them again.